Thank you so much for joining us for the first Lunch and Learn session of the PPMD virtual conference. We really appreciate you joining us. I'm Ryan Fisher from PPMD. I'm joined by my colleague, Brian Denger. Together, we're gonna lead today's Lunch and Learn session about the Duchenne Family Assistance Program. So really briefly, before I hand it over, I've known today's speakers for well over a decade. They are an amazing, knowledgeable team of Duchenne moms who have dedicated their lives to this community for many years. A key part of the mission of the Duchenne Family Assistance Program, which I personally love, is to remove barriers that might prevent families from getting everything they need to live their best quality of life. I've seen firsthand the impact they've had on many families across this country, and I consider myself lucky to know them and have them in my own life. And we work closely with them at PPMD on many things, from research to programs that impact the community. So Brian Denger is going to lead the Q&A today, so please feel free to enter questions, comments in the chat box. Brian's been leading PPMD's efforts to guide families through IEPs, education, insurance, navigating resources, that exist in different states for a decade and a half, and building our community resource. And this is why there's such a great fit with the Duchenne Family Assistance Program. It's created this ideal collaboration with PPMD. Oftentimes, we're able to point families directly to DFAP, which we call them the easy acronym name. They provide one-on-one case management to remove those barriers that exist on a range of issues, which they're going to talk about today. So with that, it is my pleasure to hand it over to Marisa Penrod to start us out. Marisa?
Thanks, Ryan, and it's great to be here today. Thanks so much for the kind introduction, and all those things you said. I can speak for our team in that we love you just as much. And we're so grateful for so many things you've done and that Brian has done to sort of pave the way and open these doors and help all of us understand what the needs are in the community. So today, what we're going to do on this webinar is we're going to give you an overview of the Duchenne Family Assistance Program. We're going to talk about some specific situations we've had, how we've helped people. We're going to let you know how you can get help, and we're going to save some time at the end for questions and answers. So first of all, I want to let you know that we're going to tailor this today for try to hit as many ages and stages as possible. We know that some of you watching this might be newly diagnosed with a 2-year-old or a 3-year-old, and some of you may have been in this community for 5, 10, 15, or 20 years and have a young adult with Duchenne. So we've kept that in mind, and we hope you'll keep that in mind too, that we're going to try to address a range of needs and issues. So first, Kelly will be talking in a few minutes, but Kelly and I always like to share just why we decided to launch a family assistance program, and it's really simple. We both have boys with Duchenne. My Joseph just turned 17, and he was diagnosed when he was 5. And when he was diagnosed, I formed Team Joseph, and I wanted to fund research. And so that's why I worked so closely with PPMD and to fund research. So as Joseph's journey progressed, and if you've been in this more than a couple of years, you know, as the journey moves along, so do the needs. And there was sort of a pivotal moment for me when Joseph lost ambulation at the age of 12. And we needed a power wheelchair, and I fought a pretty good battle for that to get insurance coverage. I had to modify my home for an accessible bathroom. I was taking care of both of my elderly parents in their final years of life. I had a daughter leaving for college. I had another son in high school. I'm a single mom. And so I would have these moments where I would just, at the end of the day, out of exhaustion, say, oh my goodness, how do people navigate this journey if they don't have good health insurance, if they don't have a supportive community? And I am fortunate that I have those things for my son, and yet I was exhausted and thinking, how am I going to do this long term? Because we know that Duchenne's not a sprint, it's a marathon. And so I started to question, how is our community getting by? How are people navigating this? So I started to ask that question. I talked at length with Ryan. I talked to doctors, and a pivotal moment for me was when a doctor, a neurologist, said to me that she has patients who are unable to make it to their clinic checkups because they can't afford train fare into the city, or they can't afford the parking fee. And that changed things for me. And I thought, we will always fund research, but we have to take care of people right now in this moment today. And we can't allow the ability to care for our children with a difficult diagnosis and a long-term disease to be dependent on our ability to pay and whether or not we have health insurance. So how can we help our community right now? And that was really the beginning. And then I was talking to Kelly, and she was having her own journey and fighting insurance battles, which is her expertise. And so we decided to team up and start the Family Assistance Program. The main mission, we like to say, is that we want to eliminate stress and suffering for our community. And more importantly, and Brian, you can switch it to the next slide. More importantly, this is our tagline is, you are not in this alone. This is actually a cover shot of the brochure that's in your goodie box that you got from PPMD. And that's really the point, is that you shouldn't have to navigate this alone. We're better together, we're stronger together, and we can do better for our community than everyone just having to navigate things on their own. So next slide, Brian. So here's a little overview, and this is also on our DuchenneFAP.org is our website. But here are some highlights of some things that we like to help people with. So travel assistance. We believe very much that everyone should have access to a great multidisciplinary clinic. It's difficult for a lot of people to pay for airfare and hotels and whatever else you might need while you're there. So one of our programs that Team Joseph administers, and this is, you saw on the front slide, this is a collaboration between Team Joseph and Little Hercules Foundation. On our Team Joseph arm, we deal a lot with direct assistance, direct financial support. So we believe very much in doing what we can to help everybody get to a good clinic. And so we help the travel costs. The other thing that we do that we're really excited about is we help with equipment. So when you're diagnosed with Duchenne, things are constantly changing and evolving. So your needs evolve over time. So you might be looking at a home modification. You might be looking at that big Herculean task of trying to get an accessible vehicle once you have a power chair. We do down payment grants for vans. We help to coordinate resources and look for other options for you of funding sources. And then we help with equipment that's not covered by insurance. So maybe it's a ramp in and out of your house. Basically, we look for any way possible that we can help. So those are a couple things. Next slide, please. So the other thing we do collectively as a program, the team from Little Hercules and the team from Team Joseph, is that we look for resources to help you. So Amy Akins is going to talk in a minute about Medicaid and Medicare. You might have questions about clinical trials and different clinics where they're running those. You might need housing resources. There's all sorts of things that come up, and we're open to hearing from you about what those needs and those questions are. And then, of course, we're going to get a little bit more about insurance denials. So we'll give a little bit of some in-depth. Next slide, Brian, thanks. So here are some tips from us we want you to know. If you're newly diagnosed, you might think, a Medicaid waiver, why would I ever need a Medicaid waiver? What we want to just say to you is apply before you think you need it. And that's really for so many things in this journey. Apply for what you think you might need down the road. Start now. Don't wait until you need it. If you're looking at equipment or anything that requires you working with your insurance company, if you get a denial, respond ASAP. If you need direct financial assistance, like to travel to a clinic appointment, or you want to apply for support for us helping you with a home modification or even a ramp out your front door or your back door, reach out to us before you pay out of pocket. We're pretty firm as a program that we don't do reimbursements to families. We like to pay directly to vendors. So everything about how we, kind of coach people and walk hand in hand with them on this journey is to start early and to be proactive. Plan ahead, take baby steps, take it one day at a time, and be as proactive as you can. The other thing I want to let you guys, everybody listening and watching, know is that we have a rolling application process. So you can go to our website, you can apply anytime, any day of the year. You can apply in the middle of the night, you can apply at 6 a.m. Whenever you need help or you're starting to plan ahead, you can apply. There is no application period, or there are no limits to that. So we're here for you, 365 days a year. You can go on that website and apply, and we'll take a look at an application. Next slide. I'm going to give you a couple of quick examples, and then I'm going to turn it over to Kelly in just a minute. So here's from one of our great families we've helped. They wanted some assistance getting to clinic. Hunter's grandma said, we're so blessed. We're getting the best care. Everyone on the team's on the same page. They know more than we do, and that's not always the case at clinics. And I love this so much because Duchenne parents tend to be really committed to researching and being very highly educated about care. And when we go to a clinic and we're like, hey, they know more than we did, that's pretty exciting. And we have some incredible certified clinics who, and really good multidisciplinary clinics who everybody should have a chance to go to. So we want to show you the next slide, which is a picture of Hunter at his doctor appointment. There's sweet Hunter finally getting to the clinic that they desperately wanted to get to see. And that's, of course, as so many people know, that's Dr. Jerry Mendel. So one more quick story for you guys, just about how lives are changed. This is from sweet Calvin and his wonderful mom, Nicole. Nicole is also, for other reasons, is in a wheelchair. She's been unable to go to doctor appointments with her son, Calvin. Since the time Calvin was diagnosed, they've never gone anywhere as a family, all of them together, because they didn't have a vehicle. So we were able to help this family purchase a handicap accessible vehicle. And if we go to the next slide, you will see our buddy Calvin with his van. So what we mostly want to tell everybody that's tuned in is there's a lot to manage in this journey, and there are always options and always choices, and there's help out there from this community. And we're super excited to be there in that capacity for everyone. So we're going to hold the slide right here, and I'm going to bring on my dear friend and I was going to say partner in crime. We'll just say that. My partner in crime, Kelly Maynard in the Duchenne Family Assistance Program. Kelly, you are up, my friend.
All right. I was having trouble unmuting there. Thank you, Marisa. And it's so good to be with all of you here on this Zoom session. Although we really miss being with you in person, it's one of the highlights of our year is to be with our Duchenne family and catch up. So I hope all of you are safe and staying sane during these crazy times. So just a little bit about me. My son, Jackson, was diagnosed at the age of 5. He's now 13. At the time that he was diagnosed, I was rounding out a 20-year career with the state of Ohio and state government, and I was working in insurance regulation. And I had no idea at the time how that background would serve me in what I'm currently doing. A little bit about our team. You're going to hear from them in a few minutes. Jen Shumsky is also a Duchenne mom, but she's also a nurse, and she worked for a health plan. And Amy Akins, who is also a Duchenne mom, her background before she came to work for us is in Medicaid and Medicare, and she lives in Pennsylvania and was running those programs in her state. So next slide. So we wanted to highlight this story for you. This was something that our team worked really hard on. JB was transitioning. He was coming off of his feet, and they were in the process of ordering his wheelchair. And as you can see, became really frustrated when both their primary coverage and their secondary coverage, which was Medicaid, denied several components of the chair, like the elevate function. And we see this a lot. This is very common. Many health plans don't see these functions as medically necessary. They deem them as a convenience item. We vehemently disagree with that. We all know that maintaining independence is critically important for our children. So, and also during the time that they were fighting the insurance denials, the JB had 2 major falls, and they were very serious. And those of us who have been through that transition phase, we all know those Duchenne falls are they're not normal falls. They're scary, and they can lead to major health issues. So that's what happened here. So we knew that we had to move very quickly, and we needed to get what this child needed as quickly as possible. Next slide, please. And my team was very successful in doing this, as you can see. And we were able to demonstrate that the elevate function and the standing function on a child's wheelchair is directly supportive of their social and mental welfare. And JB was interested in cooking, and he attended a cooking class. And as you can see, it would have been very difficult for him to participate without those critically important features of his wheelchair. So just wanted to highlight that for you as an example of how we can assist in this very difficult and frustrating process. It can become overwhelming. So reach out to us. Our team is always here to help, and this is what we do. We love this. So now I'm going to introduce Jen Shumsky.
Hi, everybody. Thanks, Kelly. I just had to get myself unmuted there. And I just want to give a shout out to the members of our Duchenne Family Assistance Program that are not featured in this panel right now, for Mindy Cameron and Doreen Pulgini, because, we are such an amazing group that brings so many different things to this organization that, you feel like you can't quite function and one of your team members is gone. So just wanted to shout out to them. The first thing I'm going to do is just do a very high level insurance discussion. This is going to be more focused on commercial insurance because that was where the majority of my experience lies, and go over just a few terms. We're not going to go through all of these, but I want to give a resource of healthcare.gov is a great resource for finding definitions and also for learning more about insurance if you're looking to find out more on your own. The terms we'll go over is co-payment is a big one. And people get co-payment and co-insurance kind of confused. A co-payment is a fixed amount that you're going to pay for your covered healthcare services after your deductible has been met, whereas co-insurance is the percentage of cost that you may pay after you've paid your deductible. So co-payment is a set amount, co-insurance is a percent amount, and that is going to be based on what your plan agreements are. Want to touch on the word network. Network is very important because those are the facilities, the providers, the vendors that your health insurance plan has contracted with to provide healthcare services. And if you do not use utilize within your network, you could face non-coverage of whatever you're trying to obtain. And then coordination of benefits is just a way to figure out when you have multiple payers who's going to pay first. Typically, Medicaid is always the last payer in order. So if you have a commercial plan, Medicare and Medicaid, your commercial plan is always going to go first, then your Medicare, then your Medicaid. So it can be very frustrating when you have two plans because the prior authorization has to go through your primary plan, and then your secondary plan is going to do a prior authorization kind of based on what the first plan went through. And then pre-authorization, I think everybody should hopefully know what that is, but that's just basically a decision by your plan that whatever it is that you're looking for, medication, treatment, equipment, is covered. It can be called a prior approval, pre-certification, many different things. The most important thing to remember, though, is a prior authorization is not a guarantee of payment. It just says that based on the information they have in front of them right now, it looks like they're going to pay for that. But if the claim comes in as something different, that can mess stuff up. So just so you know that. And then excluded services, those are items that are just not covered by your plan. Many times if you're on an employer plan, there's going to be separate things that your employer may choose to cover or not cover. And I always recommend getting a copy of your plan from your human resources department. So next slide, please. DME, it's one of the primary things we use in this community. It starts from an early age. Typically, after diagnosis, one of the first things you're going to be getting is AFOs. I always recommend that, even though it's one of the most frustrating parts of being a Duchenne parent, that you reach out to your insurance payer. And that can involve, I know, hours on the phone, but it's important to call and find out what equipment they cover, what part of the payment you might be responsible for, and then most importantly, who are the network providers that you must work with. You want to find that out ahead of time, because we have seen families, again, where they go to the, in their early days and they say they need an AFO or an ankle foot orthotic that will help keep the feet stabilized, and they send them on their way, and they'll go to someone that they know, makes AFOs either within their organization or someplace else. And when all is said and done, they weren't covered by their insurance company. Now you got this $2,500 bill. So very important to find out where you need to go ahead of time. Also, talk to your provider about any items that you feel that you need, and also ask them about anything that they're recommending at this time, because we only go to the doctor primarily, every 6 months for clinic appointments, and most insurance is going to require a face-to-face discussion with your doctor about those items. So if you have those discussions at your regular visits, your physician can put those notes into your office visit, and you don't have to make a separate visit or wait until your next visit to have that medical documentation, at least in the office visit form. Your doctor usually is going to give you the prescription, or they will send it directly to the DME company of your choice. That's going to depend on your provider. And then whoever you're working with as a DME vendor, they should obtain prior authorization from your insurance. And it's okay to bother them and bug them, hey, did you get prior authorization? It's typically, and it can take 15 to 30 days, but it doesn't mean that you can't stay on them and ask, because sometimes things get forgotten. Okay, next slide. And last, I'm going to touch on, unfortunately, denials, because that becomes a part of our Duchenne world, sometimes early, sometimes often. I'm going to just do a couple definitions with this. The first is for a grievance, because a grievance is actually a complaint that you communicate with your health insurer or plan, and it's any complaint other than one that involves a coverage decision. So if you're dissatisfied, you didn't get your denial letter in time, they lost your appeal or your prior authorization. Any type of thing that you're unhappy with, you can file a grievance with your insurance company. You know, we can also work with you to help find your local insurance commission that you can also send grievances into. An appeal is a request for your health insurance company to review a decision that denies a benefit or payment. And there are multiple appeal levels that depend based on your plan. And then I want to mention one of the final appeal levels is an IRO, which also stands for an independent review organization. And sometimes that is, you know, the one place where you might see that we can get things overturned, because your insurance plan has to send your appeal off to this independent organization that's not attached to your insurance, and they do their own expert peer review of what you're asking for with medical necessity. So that's an important thing to keep in mind. And then a fair hearing is just a proceeding before an administrative law judge when you don't agree with a change or denial of Medicaid services. Not many commercial plans offer fair hearing options, so that's something to keep in mind. You know, when you're notified your request is denied, the first thing you want to do is read that letter that you get. It's going to tell you, insurance companies everyone is required to send you a denial letter. Any services that are not covered, they have to send you a letter telling you this. It's going to tell you what was denied, why it was denied, and what your next steps are. The big thing is timelines. There's a deadline and timeline for your appeals or next steps. It might be something was denied simply because there's no documentation. If that's the case, reach out to get that documentation to them. Not everything requires an appeal. I know there's memes out there of, if your health insurance denies something, call and ask for the name of every single person that reviewed your case, or just call the number and they'll put you through to someone and you'll be able to get it approved. And unfortunately, that's not typical for most plans. Your best bet is to read your letter carefully and reach out to us. If you have any questions, reach out to your providers first. We always want you to work with your physician or your vendor first. We don't want to step on any toes, but always feel free to reach out to us and we can help you through this process. So now I'm going to turn it over to Amy Akins to discuss our government programs.
Amy, I think you're still muted. You have to unmute.
Oh, am I okay now?
You're okay now. I didn't want you to have to go on more. So go ahead, take it away.
It said the host had me muted. Very strange. So good afternoon, everyone. And thank you, Jen, for that introduction. So I'm going to talk a little bit about, next slide. I need the slide. Sorry. The Medicaid, Medicare slide, Brian. Can you back it up? Thank you. So many of our families depend on government programs for help in meeting the multiple needs of Duchenne. And as we all know, there are many. I'm just going to take some time to highlight some of the more commonly used government programs. And I know a lot of you are probably already aware of these. But as Maurice had said earlier, we have a lot of folks that are at different stages of their journey with Duchenne. So some of this may be new material. So the first one I'm going to talk about is Medicaid. So what's Medicaid? Medicaid is a state program that provides health coverage for eligibility groups such as low-income adults, children, pregnant women, and finally people with disabilities. And many Duchenne families have both commercial and Medicaid for their children to help meet the multiple needs. States administer their programs in a variety of ways. And in many states, you can obtain Medicaid for your child with DMD, even if your income might be above the traditional limits for the program. traditional income and asset limits. And they do this by programs such as TEFRA or TEFRA-like programs that you may have heard of, Medicare buy-in programs, and Medicaid waivers, which I'm going to talk about a little bit later, but Marisa had also referred to those programs. And then the other government insurance is Medicare. So I put Medicare on here because it's often confused with Medicaid. Medicare is the federal insurance program, and it works the same across the country. Some adults with Duchenne do receive this health insurance. In general, a person becomes eligible for Medicare after they've been eligible for SSDI or Social Security disability insurance for a period of 24 months. Next slide, please. Medicaid home and community-based waivers, or home and community-based services, or HCBS, are programs that are sometimes referred to as waiver programs. And the reason they refer to these as waiver programs is because CMS has allowed the state to waive certain requirements of their Medicaid program in order to provide additional services. So they cover services that aren't usually covered by Medicaid to help people stay in their communities. Services can include things like assistance with funding with home modifications or support staff, skill building programs. And as needs increase in Duchenne, these services become really, really important to meet our ongoing needs. Recently, a family came to us for assistance in finding ways to meet the changing needs of their 9-year-old daughter who's living with DMD. The family reached out to us because they needed information on waivers, as well as how to obtain a power wheelchair soon after a manual chair was placed due to her progression. So our staff provided some guidance on how to discuss this need with her provider at her next appointment, and also some guidance on how to apply for a waiver program in her state for some other needs that she had. Following the discussion, they had the discussion with their provider. A power wheelchair was ordered and subsequently approved based on that changing medical need. The family also utilized the waiver information they obtained. They applied, and as of July 1st, I'm happy to say she's enrolled in a waiver program. She and her family are now going to have the opportunity to get assistance with some needs they have, such as respite, home modifications, and potentially some assistance with vehicle modification. So wonderful success story there. And for those that aren't eligible for traditional Medicaid, waiver programs are also a way that some obtain it. So often parent income and assets are disregarded in determining a child's eligibility for these programs. It is important to know that these waivers are provided to individuals in specific groups based on whatever the state has put in their application that's approved by CMS for specific diagnosis or disability. So for example, in some states, there has to be a cognitive disability in order to qualify for the developmental disability system. But every state is different, and that's one of the things that we can help folks work through. One thing to keep in mind with these is that there are waiting lists. They're allowed by the government, and those waiting lists can be sometimes very long. In some states, several years. So getting on an interest list early or wait list, even if you're not sure that you're going to have these additional needs, is often a good plan. Next slide, please. And then I'll just quickly cover supplemental security income and Social Security disability insurance. Supplemental security income, or SSI, provides cash to meet basic needs for food, clothing, and shelter for people who are disabled or have little income. Disabled children under the age of 18 whose parents have little income or resources could be eligible for SSI if they meet certain conditions. But one of the things that the Social Security office does do for those under 18 is they use a process called deeming to determine financial eligibility. So what deeming basically means is that they consider some parent income and resources to be available to the child. And if you're over a certain income, you don't qualify based on that. However, the good news is when a child reaches the age of 18, the Social Security Administration uses different medical and non-medical rules when deciding if an adult can get SSI disability payments. And those parent income and assets are no longer considered when they're looking at determining their eligibility. The other Social Security program, Social Security Disability Insurance, or SSDI, pays monthly benefits to people that are unable to work due to disability. If certain conditions are met, adult children, we say children because they're paid on their parents' Social Security income or Social Security earnings record, they may be able to qualify for that if they have a disability that started prior to age 22. I definitely recommend getting on the Social Security Administration's website for information on this. That if any website has lots of information, it's the Social Security Administration website. So it's out there, and I'd encourage you to look. Next slide. Next slide, Brian. Oh, thank you. And finally, one of the other resources we offer through our program is the resource tool. So of course, we're always here to help, but if you're interested in doing some research of your own, a link to our resource tool can be found on our website, http://duchennefact.org. So that's where our resource tool is. And this website is also the website where you would apply to our program. A number of community resources of various categories are found on our resource tool. You can search based on your zip code, and there's also an option to search for specific terms. So for example, if you want to learn more about waiver programs, you would type the term Medicaid waiver in the search bar, and it will give you a list of what may be available. And now back to, I think Brian is going to be coming on for questions.
Okay, great. Can you all hear me? Okay, wonderful. So one of the things I'd like to mention is part of PPMD's work has been the establishment of the certified care centers, and the resources that families are availed to at these clinics is a multidisciplinary program that meets the care consideration recommendations for an individual with Duchenne muscular dystrophy. And one of the things I would like to use this example for is the Family Assistance Program can provide assistance to families for travel. And I wonder if Marisa might discuss how, when a family applies for the process, what's the time frame? What's the typical application cycle look like for someone?
Okay. Can you hear me? Am I?
Yes.
Oh, good. I'm unmuted. So the process is. So again, and this is for everything, Brian. So I can start real general, and then I can funnel into travel. So for anything you've heard today, or maybe you haven't heard, but you have a question, it's just on our website, duchennefap.org, which is actually on the screen right now, which is great. And there's an application on there. It's a very simple application process. And so people fill out the application. What happens then, and it automatically goes into, we have a case management system. So your information is put in. Our team, and again, and Jen mentioned this, Jen and Amy are on the call, but Doreen Pulgini, who a lot of you who are on here right now have worked with through our team, Joseph Arm, and then Leslie Guzman, who just started working for Team Joseph. She works on cases as well, and we're super excited because Leslie is bilingual, so she'll be a great asset so we can serve more people in a more efficient way. So you fill out the application, it goes into our system, we take a look at your request, and we assign it to one of our case managers. And so to your example, Brian, if that's for travel to clinic, what would happen is probably it'll be Doreen, sometimes Leslie, and then we just start working with you. They'll reach out and they'll ask you, if you haven't already told us, when your appointment is and where you're coming from, if you're looking for assistance with gas money, or you need flights, or you need assistance with hotel. We just sort of kind of go through a checklist of what your needs are. And then we start looking at when to book tickets and, hotels and things like that. So that's actually, in our mind, that's one of our more simple requests, because it's just a matter of timing and when the appointment is. And we've helped with things, we've helped with things like sometimes people need to rent a vehicle when they get to the city that they're going to. Sometimes they just need gas money. Some people are really struggling and they ask if we can support them with a little bit of assistance for, meals on the road. We try to customize it to what that family really needs, while also, being careful about our own resources and what we can do. But we try to make it so that we remove all the barriers so that you can get to a good clinic. And as you know, Brian, I mean, we talk about this all the time that, when you get to a clinic, it's where your care, it's like the foundation for your care. And even if you can't go all the time or every 6 months, we want people to have access to that. And also that's where people can start to talk about clinical trials in a more in-depth way with a care provider. So we're really committed to that. Does that answer what you're?
Yeah, absolutely. The only other plug I'll add for the certified Duchenne care centers is they typically work in conjunction with a family's own local medical team, because your local team may not have the proficiency. And so if you develop a local team and you need some additional expertise, these clinics are typically willing to help families in their community, their doctors within their community.
Yes. And Brian, I want to add this right now so I don't forget. So one of the things about clinics, which are wonderful, is that we work really hard on reaching out to the clinics. So we have a great relationship with a lot of the social workers and a lot of the neurologists, a lot of the care providers, and they're really good about reaching out to us and saying, we have a family who would like to come, but they just can't swing it. So it's sort of a back and forth collaborative partnership relationship. And you made me remember that what I want to say on this webinar is that I think it's really important for our community, for anybody watching, to look out for each other, to take care of each other. That's really what this program is about. It's about how can we as a community, how can we take care of each other? That makes me cry. But we need to be there for each other. And so I want everybody watching to say, okay, I'm okay. I'm good right now, but you know what? I saw this family on Facebook and I think maybe they might need some help, or I have some friends who aren't plugged into Facebook or to social media and I think they might need help. So we really encourage people in the community to be aware and alert of, their other families who might need some help. So don't be afraid to refer people to our program. We count on that.
Absolutely. Once we've learned to fish, we should teach others, correct?
Absolutely.
So we've had a number of questions regarding the application process for state benefits. And I wonder if Kelly and her team would just briefly describe how, beginning with the deeming of an individual of being disabled, and how that is the segue for most states' Medicaid program, whether it's a straight Medicaid or based on income, or it's a Medicaid waiver like a Katie Beckett program. And just for a child rather than an adult at this point.
So is that you, Amy? Oh, Amy's having trouble getting unmuted. Danny, can you help her with that?
Okay. I'm here. So generally, when we're looking at qualifying children for things like TAFRA, I mean, what we're looking at to determine eligibility is something called level of care. And basically, someone would need to meet what they call level of care for an institutional level, whether it be for, they'll say they would qualify to have their needs met in some sort of a placement, whether it be a nursing home or something like that, but instead are choosing to get your services out in the community. So that's for the HCBS waiver programs. For TEFRA programs, it's very similar in that that level of care still needs to apply. So they'll go by your disability and where you are. So just the diagnosis of Duchenne may not qualify you for, let's say, a TEFRA program in some states. In others, they may, do their process a little bit differently and view things a bit differently. So it really is variable based on what state you live in. I'd be happy to help anyone who would need personal assistance with these things, because it is a very complex process, or at least it can be. And some guidance is always a good thing.
Right, and I think that's probably the most discouraging thing for families who enter this community and learn from somebody else through social media that there are benefit programs that are available, yet the distinction between what happens in the Northeast versus the South versus the Midwest could be dramatically different. But ultimately, the Social Security Administration has criteria that an individual must meet, and that is usually used as the gatekeeper for their Medicaid program. So once an individual has been deemed disabled by Social Security rules, then Medicaid is supposed to be automatic, but it doesn't always happen that way. So how would you maybe talk about how the distinction between someone who becomes 18 and how that is different from a child who is applying for Social Security disability benefits or a waiver program?
Well, with regards to SSI, once they turn 18, as I'd said in my presentation, they no longer look at parent income assets, so they just look at the individual. And when they're looking at determining eligibility, there is the disability determination process, and they're looking at how a person cannot be able to be actively employed. So they're disabled enough that they cannot maintain employment. So that's what they're looking at. It's really helpful to know all your providers, provide all that information to the Social Security Administration. Show up at your appointment with any documents that they requested or suggested that you have. I think those things are very important.
So that there have been questions regarding insurance denials, and can your team discuss how you might be able to help a family with the process of appealing a denial, whether it be for medication or for durable medical equipment, and what sort of resources you compile, and what recommendations do you make to families to begin the process by developing their own self-advocacy?
It's our goal in helping families with appeals, I just want to say, is, like you said, to teach them for the next time something is denied, to be able to feel confident in doing an appeal themselves. We always want to make sure that they've discussed with their physician, their vendor, whoever, that they are not going to be doing an appeal. Sometimes your insurance will take an appeal from your provider or from you, but not always both. Sometimes, depending on your plan, your physician has no appeal rights, and you are the only one that can appeal. So if somebody reaches out to us, the first thing we want to do is we want to be able to see all the denial paperwork that people have, so we can figure out why something was denied and what their time frames are. And then we guide them through crafting an appeal letter, addressing all the things that were denied. We have the ability to pretty much pull up medical plan documentation. So we want to look at that medical plan very carefully to see what their criteria are. Sometimes we just know enough to we have articles and supportive peer-reviewed documentation that we will include for them to send in their appeal. So really it's just to answer any questions, to guide people through the process and assist them in doing that appeal, and then going to the next level of appeal if needed.
So John, I'm gonna tag team on your comments, because that's actually what we do in the program, is we tag team on this. So if there's a situation where, you know, the appeal, you know, let's just say it doesn't work. I use layman's terms a lot. It doesn't work. And they're basically like, nope, you've tried everything and this just isn't going to get covered. So programmatically, that's where Jen will turn it back over to Team Joseph, to Doreen, or to me, or now to Leslie, and say, hey guys, we've exhausted our options. Can you guys look at how you could help with direct financial assistance, or with other resources in, you know, foundations or programs, or what else can we do to potentially help get with what this family needs. So that's part of the flow of the program too, is that we're really looking at all options so that we can help in the most significant way possible. There's one thing we didn't talk about, and I just want to say this because this is we're so proud of this partnership with PPMD, but I know that we're doing this on a Zoom and nobody's traveling anywhere. Well, some people are a little bit, but in general, we're not traveling. So we're not having in-person conferences. But one of the things that we do as part of the program too is we believe very much in the fact that everybody should have a community, and whatever it means to you. For some people, it's social media. For some people, it's just a couple people local. For some people, going to a conference or a meeting that's their lifeline. And we don't want that to only be available to people who have the financial means to travel, or to take a day off, or to go to, you know, to pay their way. So we have a scholarship program for traveling to educational events in the Duchenne community. So I just want to put that out there, that obviously we're not doing that this year because they're all remote. But because we're going to travel again. I know we're all going to get to be together again sometime soon. We do have a program for that. And then we also, you know, we don't have this on the slides, but we also are very committed to helping people with emergency situations. And I can't really get into all the specifics on that in this time, but we do want you to know that if you have something unexpected, you know, I always say there are people that are doing every single thing they can, and things happen on the Duchenne journey where you might have to be out of work. Your son might be in the hospital for a week and you're not getting a paycheck. There's all sorts of scenarios that come up. So if you find that's happening, again, reach out to us as soon as possible, because we have a better opportunity to help you with direct financial assistance, and also like Amy looking for resources and programs if you start that early. So if you've got an emergency, reach out and we'll see what we can do. Back to you, Brian. Anything else?
Sorry, that's okay. That I was muted and was fighting with it. So dealing with private insurance is probably oftentimes more challenging. Families who are looking for specialized Duchenne medication will oftentimes find difficulty in getting approvals. It's very important to get your health plan, a copy of your health plan, and discuss and find out from your employer or if it's a group plan, the formulary that covers medications and the generics versus the regular drugs that are available. Have you worked with folks regarding getting access to more specialized medications, and how has that worked for you all?
So, Jen, can I take this one and then I'll punt it over to you? So great question. So gaining access to a specific treatment that is approved specifically to treat Duchenne can be challenging. And what we saw was when our first drug was ever approved back in 2016, we saw many payers limiting access to those that could still walk, or We just saw some really kind of crazy stuff that we didn't anticipate. And so this is when the appeal process becomes critically important, to stick with it and go through all the way to external review. What we've seen with these treatments is that the payers try to limit access to what the clinical trial population look like, and not according to the FDA label, which tends to be, is meant to serve all patients with the diagnosis. So the reason I mention that is because we are also focused on the public policy piece of that, and we engage payers and states in that process. So, and then I'll turn it over to Jen to see if she has anything to add.
I just want to add, for Duchenne specific drugs, the ones that have been approved, PTC and Credo Pharmacy, they will handle appeals up to the final level, typically internally. Not that you have to go with them, but that's something their expertise says. And same with Sarepta Assist for the 2 exon skipping products. They offer internal assistance. But again, depending on your plan, if they don't have the ability to do the appeal for you, please come to us. Or if you just have questions about how the process goes, even if they're helping you with it, you're still welcome to reach out to us so that we can walk you through any questions.
I just want to add to that. We do have the ability to search all the health plan policies that are out there publicly available in the public domain. We have them all in one spot. So that's something that we can access very quickly for applicants when they reach out for our help. Great.
So as we're coming to a close, we started a little bit late, so this session is we've gone over the hour. One comment I would like to make from the chat box, and I'll extend it to all the participants, was whether or not you folks accept donations. I know PPMD does. We have a number of fundraising activities, but I think that they were probably looking directly to the Family Access Network and how you all take donations.
That's super sweet. Kelly, do you want me to comment, and then you can?
Yeah, go ahead, take it.
So the great thing about our program is that we love, we think it's awesome, is so Kelly and I each have, I founded Team Joseph, Kelly founded Little Hercules, and this is a program that we run collaboratively as 2 organizations. So we do hear this question, and what we tell people is just you decide what your heart's leaning towards, you want to support. So when you're hearing things about Social Security and insurance denials, and you're like, oh, I want to fund that, I want to help with that. And if your heart leans toward, then you go to Little Hercules Foundation and you donate there. And if your heart leans towards, I want to help a family get to a clinic appointment, or with a van or a home mod, then you go to teamjoseph.org and you donate there. So it's really, we run the program together, but we encourage people when they donate, they have to do it through one or other of the organizations. So I hope that makes sense.
Yeah.
Can we mention that this is also a free service? We don't charge for any services.
Yeah. Great reminder.
And our health is not based on income either. So a lot of programs base whether they're going to help you or not on how much money you make. Our program's based in need. So that's also important to know.
Yeah, that is an important message. Thank you all. We really do appreciate the discussion. I will mention that both your organizations also support research, which is wonderful. You really have comprehensive programs, and we partnered on a number of research projects together to move the needle towards better treatments. Ultimately, this is all about improving the lives of all those impacted by Duchenne muscular dystrophy. There was a lot of questions on international families and help for international families. I do want to address that. PPMD long ago started the World Duchenne Organization. This is a link of over 40 countries of patient organizations that work together to navigate systems and try to get resources to families. So please get in touch with me so I can make sure that the groups in those countries are connected with you. And if not, we can find those resources that exist. And many asked, will this be recorded? It has been recorded and it's going to be made available. I don't see any issue unless the team sees an issue with sharing the PDF slides as well. And finally, there was a lot of individual questions, when to start SSI, SSDI, things of that nature. We're going to have all these questions logged. Your questions will get answered. I just don't want you walking away feeling like, oh, I asked this question, this means so much to me. The team here is going to help you answer those questions. Brian works directly with this group, as do I, to help navigate these things and get you the materials and the resources you need. So rest assured, we've heard you and we're going to reply to everything that's been questioned today. So with that, I want to thank everybody on this webinar for participating, and to our speakers, you did a wonderful job. We love the collaboration with your groups, and we really thank you for everything you do. I hope to see everybody tonight. We're going to have night number 2 for the virtual conference. We have a great night ahead of us, a panel on resilience and compassion fatigue, which I think everyone can understand. We're going to have the next in the pipeline session where we're going to talk about drugs targeting restoring dystrophin. And there'll be a pop quiz and another prize. So please join us tonight. And we thank you so much. We hope everyone has a wonderful day.
Thank you.
Thanks, everyone.
Thank you, everyone.